The Human Odyssey by Teddy and Marcus. Prenatal and neonatal. A zygote is the initial cell formed when a female egg cell and a male sperm cell unite during fertilization. An embryo is the early stage of human development, starting from implantation in the uterus around week 2 until the end of the 8th week of pregnancy. A fetus is the unborn offspring of a viviparous animal that develops from an embryo. Fetal development in humans is from the 9th week of pregnancy until the birth of a newborn. A teratogen is a substance that causes congenital disorders in developing embryo fetus. Teratogen is anything you're exposed to or ingest during pregnancy that is known to cause fetal abnormalities such as alcohol and nicotine. Fetal alcohol spectrum disorder, also known as FASD, is a lifelong preventable disability caused by prenatal alcohol exposure resulting in brain damage, growth deficiencies, and behavioral/learning challenges. The newborn. Rooting is a crucial involuntary survival reflex present at birth that helps babies locate a nipple for feeding. When a corner of the mouth or cheek is touched, the infant turns their head towards the stimulus, opens their mouth, and prepares to suck. Sucking is an involuntary reflex in response to stimulation of the mouth or palate. This reflex allows infants to feed, self-soothe, and typically matures into voluntary feeding behavior within the first few weeks. The Babinski reflex in a newborn is a primitive reflex where stroking the sole of the foot causes the big toe to bend upwards and the other toes to fan out, indicating a developing nervous system. The Moro reflex, also known as the startle reflex, is an involuntary instinctual reaction in newborns to sudden, unexpected stimuli like loud noises or the sensation of falling. The grasping reflex is an involuntary reflex where a baby's fingers curl tightly around anything placed in the palm. It is even strong enough to support their own weight. Maturation. Prenatal maturation is comprised of 3 stages: the germinal stage, the embryonic stage, and the fetal stage. The germinal stage takes place from weeks 0 to 2 and includes conception to implantation, forming of the zygote and blastocyst. The embryonic stage takes place from weeks 3 to 8 and includes critical periods of organogenesis when major organs form. During this stage, the embryo is highly vulnerable to environmental factors that might cause death or birth defects. The fetal stage takes place from week 9 up until birth, characterized by rapid growth in size, weight, and functional maturation of systems. Neonatal maturation takes place from birth to 28 days of age and is comprised of 4 major milestones. After the first breath, pulmonary vascular resistance decreases and fetal shunts begin to close. Fetal shunts are 3 crucial pathways that allow blood to bypass the lungs and liver in the fetus. Thermogenesis is the act of breaking down brown fat to stay warm, as neonates are incapable of shivering. A 10% weight loss in the first 2 to 3 days is normal, with birth weight regained by roughly 2 weeks. The immune system begins to adapt to external bacteria and viruses, making this a period of high susceptibility to infection. Infancy and childhood. Paiget's stages. There are 4 stages of Paiget's cognitive development. The first is the sensory motor stage, from birth to 2 years of age, where children learn through movements and sensations, and learn key facts like object permanence. The second is the pre-operational stage, from 2 to 7 years of age, where children learn to think symbolically but are generally egocentric and struggle to see something from the perspective of others. The third is the concrete operational stage, from 7 to 11 years of age, where children learn to think logically and reason, and start to understand the concept of conservation. The fourth and final stage is the formal operational stage, from ages 12 and up, where children start to think abstractly and begin to use deductive logic and reasoning. Language acquisition. There are 3 stages of language development we are covering: the prelingual stage, the holophrasic single word stage, and the telegraphic stage. The prelingual stage takes place at 0 to 12 months and is the stage where the baby has not developed speech yet, but is practicing and trying to communicate by cooing and babbling. The holophrasic stage takes place from 12 to 18 months and is the point where the child starts using simple single words to communicate, such as mama and papa. The telegraphic stage takes place from 24 to 30 months and is the point where children begin to form and use short sentences to communicate, but might miss verbs, prepositions, or articles, but still include the main words to get the point across. Social attachment and contact comfort. Secure attachments are characterized by trust, stability, and a balance between intimacy and independence. Note that intimacy does not mean being a couple, it essentially means being close with someone. Insecure attachments are generally characterized by emotional distance, inconsistent reactions to intimacy and conflict, and fear of abandonment. Both anxious and avoidant attachments are forms of insecure attachments. Anxious attachments are characterized by the fear of abandonment, rejection, and being underappreciated. Avoidant attachments are characterized by an individual's tendency to avoid emotional closeness, struggle with expressing their needs, and avoid intimacy. Contact comfort refers to the pleasure and well-being that comes from close physical contact with another person or being. It is a crucial part of forming emotional bonds, psychological development, and emotional regulation. Parenting styles. Baumrinn's parenting styles classify parenting based on 2 levels: responsiveness and demandingness. These 2 dimensions split parenting into 4 categories: authoritative parenting, authoritarian parenting, permissive parenting, and neglectful parenting. Authoritative parenting is categorized as high demand and high responsiveness. It is considered the most beneficial style. Parents set clear, consistent rules while being warm, supportive, and communicative. They encourage independence while maintaining limits. Authoritarian parenting is categorized as high demand and low responsiveness. It is characterized by strict rules, high expectations, and a because I said so discipline. This parenting style prioritizes obedience over open communication. Permissive parenting is categorized as low demand and high responsiveness. This parenting style prioritizes warmth and nurturing, but rarely sets rules or enforces consequences. Neglectful parenting is categorized as low demand and low responsiveness. This style involves providing basic needs, but being detached or indifferent to the child's emotional needs and development. Vygotsky's scaffolding is a teaching method that breaks down complex tasks into smaller, more manageable chunks, allowing students to master new skills with the help of another, more knowledgeable person. Vygotsky's zone of proximal development, also known as ZPD, is the gap between what a learner can do independently and what they can achieve with guidance from a more knowledgeable person. Adolescence. Physical. Puberty is the natural, multi-year biological process during which a person's body matures into an adult body capable of sexual reproduction. Puberty typically starts in girls between the ages of 8 and 13 and ends between the ages of 15 and 17. For boys, puberty generally begins between the ages of 9 and 14 and ends between the ages of 16 and 17. Menarche is the first menstrual cycle in female humans. From both social and medical perspectives, menarche is considered the central event of female puberty, as it signals the possibility of fertility. Menarche typically occurs between the ages of 10 and 16, with the average being 12.4. Menarche can be delayed in adolescence with very low body mass due to starvation, malabsorbance, or an eating disorder such as anorexia nervosa. It is estimated that a minimum body fat of 17% is necessary for menarche, with a 22% body fat required for maintaining regular menses. Primary sex characteristics are sexually different characteristics that a person is born with. For example, the gonads, level of sex hormones, anatomy of the internal genitalia, and anatomy of the external genitalia. In biological men, some of these primary sex characteristics are the testicles, high androgen levels, the prostate, and the penis. In biological women, some of these primary sex characteristics are the ovaries, high estrogen and estrogen levels, the uterus, and the vulva. Secondary sex characteristics are sexually different characteristics that a person develops later in life, usually during puberty. For biological men, some secondary sex characteristics are more facial hair, more body hair, taller height, more muscle mass, a lower drop in vocal pitch frequency, higher lung capacity, and a larger heart. For biological women, some secondary sex characteristics are larger breasts, wider hips, higher vocal pitch frequency, less facial and body hair, a shorter height, less muscle mass, smaller lung capacity, and a smaller heart. Both genders share the same secondary sex characteristic of underarm and pubic hair. The imaginary audience refers to a state of mind where an individual believes that multiple people are listening to or watching them. The imaginary audience effect is not a neurological disorder, but more a personality or developmental stage of life. It is a part of the developmental process throughout adolescence and is a natural part of developing a healthy understanding of one's relationship with the world. The personal fable is an adjacent state of mind to the imaginary audience, where one thinks of oneself as the center of attention. The adolescent comes to believe that it is because they are special and unique. These feelings of uniqueness and specialness may cause one to believe that they are exempt from dangers and consequences, often causing risk-taking experiences such as reckless driving or substance abuse. Sexual orientation is a personal pattern of romantic and/or sexual attraction to persons of the opposite sex or gender, the same sex or gender, to both sexes and genders, or none at all. These patterns are generally classified under heterosexuality, homosexuality, bisexuality, and asexuality. Note that these are not the only possible combinations of attractions, more exist beyond this. Sexual orientation also refers to a person's sense of identity based on those attractions, related behaviors, and a membership in a community that shares those attractions. Lawrence Kohlberg's stages of moral development is a theory that holds that moral reasoning, a necessary component for ethical behavior, has 6 developmental stages, each more adequate at reasoning moral dilemmas than the previous stage. The 6 stages of moral development occur in phases of pre-conventional, conventional, and post-conventional morality. The pre-conventional level of moral reasoning is common in children, although adults also exhibit this level of reasoning. People at this level judge the morality of an action by its direct consequences. In stage 1, individuals focus on the direct consequences of their actions for themselves. For example, an action is considered morally wrong because the actor is punished. The worse the punishment is for the act, the more bad it is perceived to be. This can give rise to the idea that even innocent victims are guilty in proportion to their suffering. Stage 2 expresses the position in which right behavior is defined by whatever the individual believes to be in their best interest, or what is convenient to the individual, but understood in a way that does not consider their own reputation or relationships with others. Stage 2 reasoning shows a limited interest in the needs of others, but only to a point where it might further the individual's own interests. As a result, concern for others is not based on loyalty or respect, but rather a you scratch my back and I'll scratch yours mentality. The conventional level of moral reasoning is typical of adolescents and adults. To reason in a conventional way is to judge the morality of actions by comparing them to society's standards and expectations. In stage 3, the self enters society by conforming to social standards. Individuals are receptive to approval or dismissal from others as it reflects society's views. They try to live up to these expectations, having learned that being regarded as good benefits the self. Stage 3 reasoning may judge the morality of an action by evaluating its consequences in terms of a person's relationship, which now begins to include things like respect and gratitude. In stage 4, it is important to obey the laws and social conventions because of their importance in maintaining a functional society. Moral reasoning in stage 4 is beyond the need for individual approval. A central ideal or ideals often describe what is right and wrong. If one person violates a law, everyone else might be obligated by a social and moral standard to uphold laws and rules. The post-conventional level, also known as the principled level, is marked by a growing realization that individuals are separate from society and that the individual's own perspective may take precedence over society's views. Individuals may disobey rules inconsistent with their own principles. In stage 5, the world is viewed as holding different opinions, rights, and values. Such perspectives should be mutually respected and unique to each individual or community. Laws are regarded as social contracts rather than rigid ethics. This is achieved through majority decision-making and compromise. In stage 6, moral reasoning is based on universal ethic principles. Laws are valid only to the extent that they are grounded in justice, and a commitment to justice carries with it an obligation to disobey unjust laws. Decisions are not reached in a conditional way, but rather in an absolute way. This involves an individual imagining what they would do in another person's shoes, as if they believe what the other person imagines to be true. As teens transition from childhood to adulthood, they might begin to feel confused or insecure about themselves and how they fit into society. As teens seek to establish a sense of self, they may experiment with different roles, activities, and behaviors. This is an important part of forming a strong identity and developing a sense of direction in life. Erikson defines identity as a fundamental organizing principle which develops constantly throughout life. Identity involves the experiences, relationships, beliefs, values, and memories that make up a person's subjective sense of self. This assists in the creation of a self-image that remains fairly consistent even as new aspects of the self are developed or strengthened over time. Identity provides a sense of continuity within the self and an interaction with others, and a framework to differentiate between self and interaction with others. Children who are not allowed to explore and test out different identities might be left with what Erikson referred to as role confusion, which can result in being unsure of who you are and where you fit in life, drifting from one job or relationship to another, and feeling disappointed and confused about your place in life. Identity achievement refers to those who, after exploration, have committed to an identity, and this is a long process and is not often realized by the end of adolescence. Individuals who do reach identity achievement feel self-acceptance, stable self-definition, and are committed to their identity. Identity diffusion refers to when a person fails to develop a stable sense of self, either because they didn't commit to one identity or aren't working towards forming one. This might result in struggling to find a sense of direction in life, constantly switching jobs, jumping from one relationship to another and feeling unfulfilled. Going through an identity diffusion period in adolescence is normal, and most people grow out of it. Identity foreclosure is the premature commitment to an identity, the unquestioning acceptance by individuals of the role, values, and goals that others have chosen for them. Characteristics of identity foreclosure include the decline of possible alternatives while committing securely to an idea, defensive egotism, low-level anxiety, and authoritarianism are also seen in those in foreclosure. They will avoid new experiences, allowing the goals and objectives of authority figures to become their own objectives. Identity moratorium is a developmental stage characterized by an individual exploring various options related to identity, whilst not yet committing to any particular path or identity. This period often occurs during adolescence, where individuals may experiment with different roles, beliefs, and values as they establish a clearer sense of self. This is a crucial time for personal growth and development, where questioning and exploration are encouraged. Adulthood and aging. Stage 6 of Erikson's stages of psychosocial development. Intimacy versus isolation takes place during young adulthood, from ages 18 to 40. Young adults seek close bonds and relationships that involve mutual care and trust. Successful formation of these intimate connections lead to intimacy, the willingness to be open, vulnerable, and committed. Individuals who successfully navigate this stage are able to form intimate, reciprocal relationships with others. They can form close bonds and are comfortable with mutual dependency. Intimacy involves the ability to be open and share oneself with others, as well as the willingness to commit to relationships and make personal sacrifices for the sake of the relationship. If individuals struggle to form these close relationships, sometimes due to earlier unresolved identity crises or the fear of rejection, they may experience isolation. Isolation refers to the inability to form meaningful, intimate relationships with others. This could lead to feelings of loneliness, alienation, and exclusion. Stage 7 of Erikson's stages of psychosocial development, generativity versus stagnation, takes place from ages 40 to 65 in mid-adulthood. Individuals focus on guiding the next generation, whether through parenting, mentoring, or community involvement. Successfully contributing to others' growth fosters generativity, the sense of productivity and accomplishment. Feeling unproductive or disconnected by contrast produces stagnation. If individuals feel they are making valuable contributions to the world, for instance, through raising children or contributing to positive changes in society, they will feel a sense of generativity. Generativity involves concern for others and the desire to contribute to future generations, often through parenting, mentoring, leadership roles, or creative output that adds value to society. If individuals feel they are not making a positive impact or are not involved in productive or creative tasks, they may experience stagnation. Stagnation involves feeling unproductive and uninvolved, leading to self-absorption, lack of growth, and feelings of emptiness. Stage 8 of Erikson's stages of psychosocial development, ego integrity versus despair, takes place at age 65 and up, in late adulthood. People reflect on their lives and accomplishments. If they view their experiences as meaningful, they achieve ego integrity, a sense of satisfaction and readiness to face life's end. Those who feel like they've fallen short may experience despair, marked by regret, bitterness, or fear of death. If individuals feel like they've lived a full and meaningful life, they'll experience ego integrity. This is characterized by a sense of acceptance and purpose in their experiences and a sense of wisdom and fulfillment. Despair, on the other hand, if individuals feel regretful about their past, feel like they've made poor decisions, or because they believe they failed to achieve their life's goals, they might experience despair. Despair involves feelings of regret, bitterness, and disappointment with one's life, and a fear of impending death. Cognitive. Fluid and crystallized intelligences are a part of the theory of general intelligence. Fluid intelligence is the ability to solve novel reasoning problems. It is correlated with a number of important skills such as comprehension, problem solving, and learning. Crystallized intelligence involves the ability to deduce secondary relational abstractions by applying previously learned primary rational abstractions. Fluid intelligence involves basic processes of reasoning and other mental activities that depend only minimally on prior learning. Horn describes it as formless and can flow into a wide variety of cognitive activities. Tasks measuring fluid reasoning require the ability to solve abstract reasoning problems, for example, figure classifications, figural analysis, number and letter series, matrices, and paired associates. Crystallized intelligence is the application of learned procedures and knowledge and depends heavily on experience. Horn notes that crystallized ability is a precipitate out of experience, resulting from the prior application of fluid ability that has been combined with the intelligence of culture. Examples of tasks that measure crystallized intelligence are vocabulary, general information, abstract word analogies, and the mechanics of language. Physical. Menopause is the time when menstrual periods permanently stop, marking the end of the reproductive stage for biologically female humans. Menopause typically occurs between the ages of 45 and 55, although timing can vary. Menopause is usually a natural change related to a decrease in blood estrogen levels. Menopause happens because of a decrease in the ovary's production of the hormones estrogen and progesterone. In the years before menopause, a woman's period typically becomes irregular during this time. Women experience hot flashes, typically lasting from 30 seconds to 10 minutes, and may be associated with shivering, night sweats, and reddening of the skin. Other symptoms of menopause may include trouble with sleeping and mood changing. The severity of symptoms varies between women. As you age, the way your senses give you information about the world changes. Your senses become less sharp, and this can make it harder to notice details. Sensory changes can affect your lifestyle. You may have problems communicating, enjoying activities, and staying involved with people. Sensory changes can lead to isolation. Your senses receive information from your environment. This information can be in the form of light, sound, taste, smell, and touch. Sensory information is converted into nerve signals that are carried into your brain. A certain amount of sensory stimulation is required before you are aware of a sensation. This minimum level of stimulation is called the threshold. Aging raises the threshold, so you need more stimulation to be aware of the sensation. Neurocognitive disorders are a category of mental health disorders that primarily affect cognitive abilities, including learning, memory, perception, and problem solving. Alzheimer's disease is a neurodegenerative disease, and it is the most common form of dementia. The most common early symptoms is difficulty in remembering recent events. As the disease advances, symptoms can include problems with language, disorientation, mood swings, loss of motivation, self-neglect, and behavioral issues. As a person's condition declines, they often withdraw from family and society gradually as bodily functions are lost, ultimately leading to death. Although the speed of progression can vary, the average life expectancy following diagnosis is 3 to 12 years. Alzheimer's disease is believed to occur when abnormal amounts of amyloid beta accumulating extracellularly as amyloid plaques and tau proteins, or intracellularly as neurofibrillary tangles, form in the brain, affecting neuronal functioning and connectivity, resulting in progressive loss of brain functions. Thanks for your time.